Now, a hospital in KwaZulu-Natal has not had reliable running water for 5 years. This has left doctors and nurses frustrated and patients staying in unhygienic wards. The hospital has been surviving on water from tankers, but that's only enough for its theatre department. Patients aren't even able to bath at that facility. eNCA's Lethiwe Mdluli brings us the details.
This is how doctors have to prepare for surgery at Bethesda Hospital. The staff say the hospital goes days, weeks or even months without running water. According to doctors and nurses, it's been like this for years, with little intervention from relevant authorities.
You can't do simple procedures like washing your hands, moving from patient to patient. You rely solely on the alcohol that they give for us to sanitize. On some occasions, you don't even have the alcohol, so you just have to move from one patient to the other without washing your hands.
You need to make sure that patients have bath. It's so difficult to try and bath a patient without water. And another issue is that you find that you find the water, but there is no way of making that water warm. It's winter now, so patients are really struggling with bathing.
The staff say doctors and nurses are resigning because of the water crisis. There are other issues as well, with hospital management not reporting problems, safety concerns for female staff, and a shortage of employees.
We keep on hearing stories from the municipality and from the hospital side, where they talk about the boreholes not being serviced, being non-operational. So sometimes we get to the point where you just give up on talking to these people because they make up stories.
It's worse when you also have issues with even the people who are leading you as well. They don't take care of your needs, even to a point of victimization and even abuse to some supervisors and managers within the same setting of a hospital. We get to a point where even the security itself that's hired within the hospital is somehow of a risk to even the staff members. You know, sometimes they will even hop in other staff members' rooms within the residencies and stuff, male figures into female rooms without even knocking, some hopping through the windows and stuff. So it's quite a lot of other things that are happening.
Unions have had to intervene. The Public Servants Association picketed outside the hospital, calling for answers from the Provincial Department of Health.
You cannot have a problem for 5 years. You can't be able to deal with this issue. As PSA, our members will be blamed on service delivery. In residence, they cannot even be able to cook. They cannot be able to bath. It affects the hospital. Our engagement is not helping us at all. When we come and picket, it's because they are not assisting us. So you have seen that some of the water tanks have been coming because they've seen PSA that is here, they've seen the media that is here. They want to react when they are media.
The National Health and Allied Workers Union says long-term solutions are needed.
For a hospital to be run on JoJo tanks in itself, in its own, it's not sufficient and it's not sustainable. So that is why we have been always saying have a permanent solution. We proposed that they come with a system of drilling boreholes.
To get some answers about the crisis at the hospital, eNCA first went to the Department of Health, but it says water is not its responsibility.
The provision of water is not a co-responsibility of the Department of Health, but that of the municipalities. It must also be noted that the issue of the shortage of water in that area is not only isolated to the Department of Health facilities. It affects the public in general and is a matter which should be directed to the municipality.
We went to speak to the mayor of Umkhanyakude District Municipality. He promises there are plans to address the situation.
Our understanding was that the hospital, they have their own water tank. And when we engaged them on those issues, we got the impression that they are able to cover themselves through the water tank. So out of these continuous challenges, we have now decided to allocate a dedicated water tank to the hospital. Over and above that, we have already embarked on a massive program to resuscitate all our schemes throughout the district.
Meanwhile, the Health Department says it will investigate security issues and other grievances raised by the staff. Lethiwe Mdluli, Umkhanyakude District in KwaZulu-Natal.